And today is World Mental Health Day. And while nearly 3 years have passed since the COVID-19 pandemic started, people of all ages are still dealing with the mental health impact. According to the WHO, anxiety and depressive disorders rose more than 25% during the first year of the pandemic, and many people are still facing those challenges today. Psychiatrist Dr. Janet Taylor joins me now with more on that. Dr. Taylor, thanks again for being here. What are some of the biggest mental health challenges that adults are facing today?
So it's important to realize we have World Mental Health Day to promote certainly positive mental health and also bring awareness to mental health issues. And some of the biggest challenges that adults are reporting are those of anxiety, stress, burnout, and depression. So all of those factors are treatable. And it's really important that individuals recognize how they're functioning and get help if they need it.
So can you talk a little bit about that recognition? Because I know from my own experience, I had horrible sleep problems, so much so that I ended up writing a book about it. But I was surprised to find out that one of the main root causes was anxiety, and I never considered myself an anxious person. So how do you go about identifying that this is even a problem so you know then how to address it?
So, one of the biggest things is to understand that our brain is our greatest ally during this time. And as individuals are listening to me, your brain's taking in 11 million bits of information per second, and our brain is constantly scanning to see if we're safe or not. And so anxiety can arise, certainly if there are any aspects of your life that may make you feel anxious, but also just recognizing that stressors, finance, relationship, work, what we've gone through, the uncertainty with COVID and certainly ongoing racism and social issues can create a sense of dread or anxiety. So anxiety is a symptom that where you feel unsure, you may feel nervous, and something to pay attention to as a cue to dig deeper into. And sleep and a lack of sleep can contribute to anxiety, as well as certain medications. Even some medications that you take can create a sense of dread or feeling unwell.
Yeah, these things can become an unfortunate cycle. So what's your advice on how to best take care of our mental health and find a way to make it a priority when sometimes it just feels like I don't have time for that?
It has to be a priority. The World Health Organization says there's no physical health without mental health. So self-awareness, paying attention at all times to not only what you're thinking, but how you are feeling, and doing those things like your mother always taught you, eating mindfully, getting good rest, paying attention to positive mental health, surrounding yourself with people who are positive. And if you have a mental health condition, depression, bipolar, struggling with drugs or addiction, get help and get treatment. So really become your biggest ally, understanding that our brain can help us in everything.
And for parents worried about their children's mental health, what are some actions they can take to check on their child's mental health and then try to get it addressed if they feel like there is a problem?
Yes, it is a problem because our children have increasing suicide rates, especially those who are Black and brown, and our children are reporting anxiety. So check in with your children daily. Make it a point to say, how are you doing? How is your day? Do you need anything from me? Share with your children your own mental health issues or own struggles and show how you got through with it. We can teach our children how to become aware of how they're feeling and to self-regulate, to really change their mindset. Children as young as 3 and 4 can understand those emotions. They might not come out and say, I'm depressed or I'm angry, but they will say, I don't feel right. We need to teach our children to use the words, tap into how they're feeling, and recognize their ability to elevate their mood.
All right, Dr. Janet Taylor, great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.